Hello, I am Adhika from Shama Women's Center, and we are sharing a very important information about the spread of measles. There is a worrying increasing number of people in Leicester with measles, and many of these are young children who have not had their measles, mumps, and rubella MMR vaccination. So why is it important? Measles are very infective, and it can spread quickly among family. So if you had not had your 2 doses of MMR vaccination, then you can get the measles. So it can affect children and adults. What to do if you are unsure if you or your child have had your MMR vaccination? You can check your child's red book or phone your GP to check. Measles can cause very serious illness, so sometimes leading to permanent disabilities and even death. Babies, small children, pregnant women, and people with weakened immunity are at increased risk of complications if they get the measles. So what is MMR vaccination? MMR is a part of NHS routine childhood vaccination. It protects us against measles, mumps, and rubella. The first dose should be given just after the child's first birth, and the second dose at 3 years and 4 months before the child starts school full time. But remember, you can have your MMR vaccination at any age. It is safe, effective, and free of charge. What about if you do not eat pork or are vegetarian? There is a version of MMR vaccination, which is Priorix, which has no pork ingredient. Priorix also does not contain gelatin, so if you prefer this, please talk to your GP or practice nurse. What about allergies to eggs or having asthma? So if you or your child have allergy to eggs or has asthma, you can have your MMR vaccine at your GP surgery. So what are the signs of measles? Some of the signs is high temperature, sneezing, runny or blocked nose, cough, a red, sore, watery eyes. A rash usually appears a few days after the cold-like symptoms. Sometimes it starts around the ears before spreading to the rest of the body. Remember, you can remain in infection until at least 4 days after the onset of the rash. It is important to stay off nursery, school, university, work, other groups, activities until then. So what to do if you suspect you or your child having the measles? So if you think you or your child has the measles, you have to phone your GP for advice in the first instance. If your GP is closed, then you should ring NHS 111, or you can go to NHS 111 online. If you need to go to the hospital emergency department, only one parent or carer can stay with your child in the hospital. So please do not bring any other child with you. And if you are arriving with more people, they may ask you to leave. All of this will help to reduce the spread of measles in the community. If you are worried that you have been in contact with someone who has the measles, so it is important to know it can take up to 21 days to develop. If you have not had your MMR vaccine and have been contacted with a person with measles, it is strongly advised not to mix outside of your household for 21 days from the time of your contact. So please, make sure that you have had your 2 doses of MMR vaccine. This is the only way to give you and your child maximum protection. If you need more information, please see the post of usual NHS sites. Thank you.